Anxiety. It affects us all, but imagine you lived in a constant state of anxiety. For some, this is an everyday reality. What if I told you there's an emerging therapy using psilocybin that breaks through these emotionally restrictive thought patterns? Psilocybin-assisted therapy, having its roots in ancient healing practices, is now re-emerging in conjunction with contemporary psychological treatments. This might just be the non-addictive and truly cathartic answer many have been looking for. Psilocybin-assisted therapy for the treatment of anxiety is based on existing psychological theories. Today, we explore the underlying cognitive behavioral theories grounded in humanistic and positive psychology values that make this form of treatment so powerful. Let's begin. Cognitive behavioral theories involve cognitive and dialectical behavioral therapy. These two modes of treatment work with the patient before session, preparing their mind and body for transformation, ascertaining their goals for the journey within. This is commonly known as SET, or mindset. These therapies work to help patients recognize certain conditioned emotional and thinking patterns which are at the core of their anxiety disorder. Psilocybin therapy works in conjunction with these therapies, allowing our consciousness to be cracked wide open where we can, within an altered state, explore and process these emotions in deeply profound ways. It's as if cognitive and dialectical behavioral therapies are our backpack before we go on a psychedelic journey within, providing tools and resources ensuring we make it through the journey safely, coming home with a new perspective and meaning on life. Avoidance is a key characteristic of anxiety, but psilocybin places individuals in a space where these avoidance patterns can be explored, faced, and met with acceptance. Although these situations may initially be distressing, research labels them as transient yet crucial phases of psilocybin treatment. At first, patients may try to control or avoid such scenarios, but it's psilocybin's active metabolite, psilocin, interacting with a 5-HT2A receptor in our brain, a subtype of serotonin receptor, which profoundly influences mood and cognition. This activation allows patients to undergo cathartic breakthroughs by surrendering, letting go, and navigating through deeply suppressed emotional states. There's a significant emphasis placed on the patient's setting for the treatment. The setting in this regard relates to their physical environment, where patients need to feel safe, comfortable, and have a previously built rapport with their therapist, who's trained in meeting them with constant empathy and understanding, acting as a grounding point as they witness their patients explore mystical and transcendental experiences. The real work occurs post-session, whereby meaningful conversations between therapists and patients then translate their profound insights into lasting behavioral changes, documented to last for 6 months after just a single session with psilocybin. In psilocybin-assisted therapy, it's not for the therapist to guide or heal, it's to hold space for the patients while they heal themselves and move through these often very deeply challenging yet spiritual spaces. If you'd like to find out more about psilocybin therapy for anxiety, please click on the Winkiversity link in the description below.